Welcome again to the Nat Health Leadership Series. This is a series that has been designed to reach out to our frontline health workers, our Corona warriors, who are who have been instrumental in this fight that our nation has been having against this dreaded pandemic. Every day over the last few weeks, we have been reaching out to the frontline workers, and we have been taking their questions and having some of the top leaders from the industry come and address them in this forum. Today, we are very fortunate to have with us Mr. Himanshu Baid, who is the Managing Director of PolyMedicure Limited. Himanshu holds a bachelor's degree in engineering, electronics, and communication. And Himanshu has worked with Philips Communication Industries as a trainee engineer for 6 months in Nuremberg, Germany. He's very passionate about doing business development inside and outside the country. And his motto is to provide medical devices at an affordable cost to the society. Himanshu started PolyMed in 1995 with his brother and has over 24 years of experience in manufacturing of disposable medical devices. Himanshu is involved in corporate strategy, finance, and sales and marketing initiatives of PolyMed. Under leadership of Himanshu, PolyMed today is the largest exporter of consumable medical devices for last 8 years from India, with over 400 crores exports per year to over 110 countries. With 9 manufacturing plants, over 3 million devices, manufacturing capacity per day, more than 125 plus products. Highest number of medical devices patent granted with over 300 patents, over 5,000 employees with over 50 people working in R&D team, a revenue of rupees 786 crores. Himanshu is also the chairman of CII National Medical Technology Forum, earlier known as Medical Technology Division, and is a Nat Health's governing council member. Himanshu has keen interest in sports, cricket, and tennis, and devotes his free time for CSR activities. For those who don't know Himanshu very well, I am one of those who are fortunate to know Himanshu. He's very passionate about the work that our frontline workers are doing. He keeps, through his large workforce, as well as through the industry interaction Himanshu has, he has a lot of diverse interactions with the frontline workers. We're very, very thankful and privileged to have you today, Himanshu, with us. A warm welcome to this particular discussion.
Thank you, Siddhartha, for having me today on this forum. I'm really privileged to talk to you and everybody who's listening to us on the YouTube channel.
Absolutely. So, Himanshu, I will keep this session interactive. We have reached out. We have some questions that have come in, and as we go through these sessions, we'll take on more questions today. I would like to welcome the entire audience who have joined from across industry, outside industry, and those who are following this series closely. All the interactions we have been having are posted online on the Nat Health social media handles, on our website, and you can go and look at all the interactions we're having, and including today's interaction will be posted in a few hours. So, Himanshu, my first question that has come up from our colleagues in the industry, at the forefront of COVID battle are our frontline health workers and professionals who are facing trauma, stress, fear of being infected, isolation, mental health issues, and just the overall sadness being away from family and loved ones for a protracted period of time. What are the top 3 messages you would like to give to the frontline health workers today?
So, Siddharth, I think first I'd like to thank all the frontline workers from the bottom of my heart. I think the kind of service they did in this pandemic period is unprecedented. And, whether it was doctors, nurses, lab technicians, people who were collecting samples, or healthcare workers, pharmacists who were dispensing medicines, or even people who are working in plants to make medical products, and especially when we were running our factories constantly every day, and people coming to work every day to make those products. I think I would like to salute them, and I think the kind of service they do to humanity is, I think, unbelievable. I think one important thing which I feel the healthcare workers should do, and I think my suggestion is that yoga, meditation, spirituality is a very important thing which releases tension. And I've gone through this when I had COVID in April, and I did meditation and yoga, and it really relieved me of the stress. And I think, to other healthcare workers who are on the show or maybe who are listening to us, I think my suggestion is that a little bit of yoga or meditation, whether it's in the morning or evening, whenever they have free time, would really help them to de-stress. And I think another important area is, we saw many doctors getting impacted, nurses getting impacted. And I think the fraternity itself, the healthcare community or fraternity itself, should think more about the mental wellness of our co-healthcare workers. And I think that is one area we're missing in the country. And I think every hospital or every healthcare establishment should have a mental wellness center to help these people get out of this trauma or stress what they have today. And I think my request to all my senior colleagues in the industry is to have this kind of arrangement where people can de-stress and get some kind of let's say motivation from this mental awareness programs.
Thank you, Himanshu. The just taking on from that question where you have left off, what were some of the lessons from the first wave or the first two waves that we can really internalize? What has been some of the contributing factors for this large escalation of cases and deaths, including the huge shortage that we have just seen in the medical infrastructure, including oxygen, ICU beds? And God forbid there were a third wave ahead. Let's hope there is none. But preparation is always better. And what should be some of these lessons that we should take forward?
I think from the first to the second wave, Siddharth, I think the key learning is, the supply chain. I think if we could, make oxygen reach in time to various hospitals, we could have saved many lives. And though we had an adequate capacity of producing oxygen in the country, but somehow we could not manage it in time. And I think the decisions we took were very late in time. We didn't learn from what was happening in Maharashtra in, let's say, mid to end March, when Maharashtra was going through that huge COVID wave. And, I think there were a lot of learnings in terms of managing the ICU bed capacity in each hospital. I think we failed to ramp up the ICU bed capacity because many people could not find ICU beds at the critical moment. So I think now the biggest learning to me is that every hospital which had maybe 20% of the beds allocated to ICUs, maybe it should move to around, and they should have that fungibility where they could even have 40 to 50% beds for ICUs. Number two is the oxygen. Today, when a hospital is designed, the number of hospital beds which have an oxygen supply is maybe 25-30% or even lower sometimes. So now I think in future, when we are looking at augmenting oxygen supplies to hospitals, I think 80% of the beds should have an oxygen, kind of outlet, so that can be given to patients, at the time of critical moment. Another area is, I think, rapid testing. I think if we are going to take 5 to 7 days, forget about the tier 1 cities or tier 2 cities even. Most of the cities like Jhansi or Gwalior, people were waiting for 5 days to get an RT-PCR test report. So by the time they were getting the reports, either they were already critical, they didn't know whether they had COVID, or they didn't know what medicines to take actually, because they didn't know whether they were COVID positive or negative. So I think that ramping of capacity in testing is very, very important, I think. And at smaller cities or even tier 3, tier 4 cities, we need to have a bigger, or let's say more efficient lab infrastructure. Another area I think is, I personally feel that social distancing norms and the mask norms were not maintained very well. If we had enforced them very strongly after knowing what was happening, I don't want to put the blame game here, but we all know that we had those political rallies, we had those, religious events. If they could be somehow be postponed in that critical period, or somehow controlled, I think would have a less number of fatalities or less number of people infected from COVID. So I think all these things, and of course the pharma supply chain, those remdesivir drugs, which were not available at the right time to people. If there was a, let's say, a portal where people could put in the request and could have been, dispensed more efficiently, more effectively, they could have saved also many lives, at that time. So there are combined factors. I think there are a lot of learnings, I would say, from this second wave. And if we act on all those 4 or 5 things I've told right now, I think we would be able to actually handle the third wave more effectively, more efficiently. Even those medical equipments which were lying in hospitals, we didn't have the technicians, trained technicians. Now, I think here, if we had known this before, that these equipments have been lying for 6 months without any use, nobody went and even started those equipments. Nobody went and even trained people to run those equipments. So I think those kind of learnings, if we are able to take care, I think we'll be much better prepared. Now, in terms of preparedness, Siddharth, your second question, I think I have a view that can we create a stockpile of medical devices and let's say pharmaceutical products and stockpile in each state, looking at what happened in each state. Like certain states were more, let's say, greatly affected than look at Maharashtra, look at Delhi, look at Punjab. They had more number of cases, in terms of population, and can we be better prepared in these states? Can we better prepared in southern states? Today Tamil Nadu is still grappling with COVID, and Karnataka, Bangalore city itself, having the best healthcare infrastructure, is grappling with COVID wave. So can we have a better, let's say, stockpile of medical equipment, pharmaceutical products, like the different medicines which we need, and can we create a buffer stock, knowing that we are going to see a third wave in September, October, November, or even December. So can we be better prepared for that? And can every hospital, which has, let's say, 50 bed, have an oxygen plant? And for this plant, can the government do a funding? Can the government give a grant? Or give us, let's say, money at, let's say, minimal cost. Government of India has put 50,000 crores for COVID preparedness, and which is giving soft loans to companies, to hospitals. So can this be done very quickly? And can we have oxygen plant in every hospital in the country, which is 20, 30, 50 bedded hospital and over? And if smaller hospitals, can we provide them oxygen concentrators well ahead of time, so that when this wave comes in, today, let's say, people are talking about children being affected. So for children, maybe we need less, let's say, capacity of oxygen concentrators. So can we bring in those 5 liter, 3 liter concentrators for children, and be ready with that? So I think these are the kind of things. And then, of course, we mitigate all the things which I've told earlier. Can we mitigate all these things with the challenges we had? So all this will help us to be better prepared, I would say.
So one of the critical challenges that happened last year was that a lot of the supply chain had to be augmented and boosted up in a very short period of time. There was real scarcity of a lot of critical supplies around the world. To what extent do you think the local manufacturing of medical devices in that environment, to what extent has it come up in the last 12 to 18 months? And particularly your organization, PolyMedicure, being one of the prominent domestic manufacturers, what are some of the steps you have taken to really fortify the supply chain, the national supply chain against the COVID?
So if we see, Siddharth, India is still importing 80% of the medical devices. And all critical medical equipments like ventilators or concentrators or CT machines were not available in India in the first wave. And of course, government, gave, brought in partnerships between PSUs and private sector. PPP model was actually first time I could see PPP model working really efficiently, where BEL and Scanray got into partnership to make ventilators. Now BPL is partnering with BEL to make oxygen concentrators. So yes, there is a potential to make these products in India. We have seen already in the between the first and the second wave, for many products, India became self-sufficient, like PPE kits, ventilators also, because we could produce 60,000 ventilators in a short time. Today, there are at least 20 ventilators manufacturers in the country. N95 masks, testing kits. India has a self-sufficiency there, more or less. Syringes. So I think there is a capability, there is a capacity, but I think if it is rightly utilized, today if we are able to, let's say, predict something, if government, let's say if government became a major buyer for ventilators or oxygen concentrators or syringes, immediately the capacity was ramped up by the local manufacturer. But if the demand is very discrete, it is very hard to ramp up capacities in a short period of time. So I think for low to medium medtech devices, India has enough capability and capacity to ramp up to meet the necessary demand. But for high-tech devices, like ECMO machines, CT tomography machines, or let's say high-level ventilators, we don't have that capability to make in India right now. So what can we do to, augment their requirements? Can India import sufficient quantity and have it as a stockpile and keep them ready when we need them? So for high tech, we still need time, but for low to medium tech, I think India has the capability and capacity to ramp up in a short period of time. And I think big companies like Maruti, Tata Steel, or Reliance, they partnered with smaller manufacturers to bring in devices at a much higher level during the time of pandemic. Reliance, I remember, had been giving that yarn or nylon material to be used in nasal swabs, for example. Maruti partnered with IFGA to make ventilators, or some certain steel companies are producing oxygen and medical grade oxygen. So there is, I think all we need to do is put everything together, and bring all the resources together at the same time rather than working discreetly. So if we pull in the resources at a central level, I think India has a lot of capability and capacity to make medical equipments in the country. So that is my take on this. And specifically when we look at PolyMed, so we are into diagnostics, we are into renal products, we're into respiratory care products. So the demand for respiratory products shot up like 6-7 times during last 2 months, April and May. So our engineering teams were able to multiply the tools, molds, machines to make these products, and we supplied a lot in this period, and we ramped up the capacity in I think less than 3 to 4 weeks. We are making VTM kits, which are used for taking samples. So today we are one of the largest producers of VTM kits in the country. We have a capacity of over 2 lakh pieces a day, whereas the country's capacity is around 220 lakh pieces. So we have almost a 10% capacity. So we ramped up the capacity in last 2 months, and we were only able to do because we had internal tooling capacity, engineering team. We could design very quickly, multiply the tools, replicate our machines. We even designed a connector for connect one oxygen cylinder to 2 patients. So engineers came up with an idea. Within 7 days, we could develop that piece, and I also even sent those pieces to many hospitals free of charge, so that they could use that connector and connect, give oxygen to more patients. And we made the technology open source, so more people could copy that design and within the country and multiply the product. So we have done that. Internally, we had a COVID task force where we took care of almost 5,000 employees in the company. Many people lost near and dear ones. We also lost 3 employees during this period, last 2 months. So it was a traumatic time for everybody in the organization. But on one hand, we were helping people. On the other hand, we had a team which was very supportive and helping us to ramp up capacities at the time where we really needed. So a lot of work was done from our team. I really compliment our employees who at their time of need really stood up to the need and really helped the community, the whole country, and also the colleagues who were in need of help.
Indeed, very well said, Himanshu. Himanshu, my next question is going to be in the area of preventive health. And there's an old saying, if it ain't broken, don't fix it. That seems to have been the guiding principle as far as our healthcare in the country has been concerned. But for the first time, you have a pandemic which has tested the country on preventive, promotive, curative, and rehabilitative spectrum. You need to, ideally, you cannot deal with the virus if everybody ends up in hospital, because your infrastructure is going to become inundated. So you have to practice a lot of social distancing, good behavior, which is our cell phone companies have been, or the television channels have been, educating the entire community on what needs to be done, including government, the public health system. Do you think that the time has come where this pandemic will leave an important lesson behind? That preventive and promotive health is equally important as curative health. And my next question is, if that is going to be important, right now you have a very large burden of disease building up, which is non-COVID in the country. While we've been all talking about COVID, in the last 1.5 years to 2 years, there's a lot of good data available that your non-communicable diseases, your elective, non-elective surgeries not tied to COVID has taken a backseat, right? What, in your opinion, are some of the things that, what are some of the lessons we need to take from here so that our wave 3 and wave 4 is not a cumulative COVID and a non-COVID wave?
So I think on the first question, Siddharth, I think I'm pretty sure that we have to be more, I think, looking at more preventive health, because in India, I think we are very reactive. So most of the time when people get sick in the country, first they try local treatment, home treatments, and whenever people get more, let's say when the things become more critical, then only people are looking at going to a clinician or a doctor or a specialist or to a hospital. I think we have to change our mindset in the country at a big time. And the biggest change I think we need to pick up is take care of our preventive health. And I think this pandemic has already taught us that lesson. And next is, I think, to me, we cannot postpone our routine medical visits. We cannot, so we both have to be taken separately. I think most of the people, it was either, people decided to postpone their, elective surgeries or elective health care, or they said, okay, I'm going to, do selectively my preventive health. So the whole system has to change in the country. So we'll have to do preventive health separately and bring it very strongly upfront so that we reduce the burden on hospitals, our healthcare infrastructure in future. And then for elective surgeries, can we segregate, in terms of which are important, and still bring those people into hospitals rather than just putting them away and telling them, if you have elective surgery, please postpone it. And I saw that announcement happening on TV from very senior politicians that if you want to get elective surgery, please postpone it. Now you can't really, because those people after a year have become critical. Today, if somebody postponed elective surgery a year ago, today it's become very critical for him, and he's still afraid to go to a hospital. So we need to bring that culture in the society, in the system, where preventive healthcare has to be taken at the forefront. And I think today healthcare is moving in the digital direction. A lot of digital technologies are coming in. So how effectively we can use digital technologies to reduce the burden on our healthcare infrastructure. That's one. Like today, when I was hearing a lot of other, my colleagues in AdHealth and talking about use of digital healthcare, and I happened to, listen to Viren Shetty. He said 40%, 46% of the consultations are now happening online. So you can imagine the kind of pressure we reduce onto the hospitals infrastructure. So, and people are now talking more about preventive health and reactive care. So digital health technologies have to brought in, at the forefront, smart health. We have to emulate models, which we have seen in maybe other countries, developed countries, bring them to India. And then of course, home healthcare is not next one big thing which is going to happen. I've been talking to some of my friends that are thinking of, putting up ICUs at home. I said, what the hell are you talking about? Where are the doctors to run those ICUs? And where are those technicians who are going to run those machines, operate that equipment? We have shortage of those technicians in hospitals. Doctors in ICU, doctors are missing in today on tier 2, tier 3, tier 4 cities. There are no ICU doctors. Only technicians are running ICUs. We have seen so many videos on TV channels. So I think home healthcare is something where we need to educate people what is possible at home and what is not possible at home. And I think that will also help us to bring a lot of preventive care in the forefront. So I think that's another area we need to look at. And I think it's all about collaboration. I think we need to bring a collaborative approach. How we can bring in medtech companies, how we can bring in, because today, let's say GE has a healthcare solution, Siemens has a digital health solution, but is that healthcare solution really helping the people? Can it become, more effective today in this kind of pandemic? And can we bring those kind of solutions very quickly and turn them around? So I think these are the areas we probably should work and bring the best knowledge. And I think NatHealth today, with such a diverse membership, I think it's the only organization which has such a diverse membership, where you have healthcare providers, you have path labs, you have medtech companies, whether domestic, Indian, everything. So you have the whole ecosystem with you. And I think here, I think the whole collaborative approach will work very, very well. And I think on the learning side, I think we need to upskill our professionals, especially in tier 2, tier 3, tier 4 cities. I think in many centers, what we could hear, what we could feel is the lack of training, and that needs to be upskilled, I think. And I think NatHealth has a platform where everybody can come together and bring certain modules where we can upskill people in those centers, tier 2 hospital, tier 3, especially when we look at government hospitals. I think they lack a lot of that training and skilling. And I think private sector has done a very fantastic job in last, I think, 2 to 3 months, when we have seen how they've stepped up. Whether when I was hearing a lot of doctors, our colleagues, who are also part of our NatHealth Governing Council and also members of NatHealth, talking on various media platforms, and how they help to really they up the ante when they were treating patients, and how they could upskill the whole team internally. But on the government sector, in the government hospital, I think that was completely missing. I think we need to bridge that gap somehow when we need to treat masses, especially people in the rural areas. And another area is about e-learning. I think today, through this virtual medium, we should be able to reach out to more people. Earlier it was hard when you're doing face-to-face training. Today, with this e-platform, we can reach out to I think thousands and thousands of healthcare workers and professionals. I think we should use this medium very, very effectively, to be prepared for the next, all the learnings we have had from the second wave. We should dissipate that to the next level in rural areas, whether it's ASHA workers, whether it is technicians. We should train them effectively for the next wave, prepare them effectively.
So thank you for going into the skilling area. I'm not going to ask you again about skilling, because you have covered it in the last question.
Yeah.
From a patient care perspective and from a provider perspective, ultimately it's a harmony between the patient, the doctor or the nurse, and the machine, right? I mean, those are the three things that has to come together in a scenario where someone's life is at risk. All of us know, Himanshu, that there is a dearth of nurses and a doctor, and while there are a lot of policy steps being taken, it's going to still be years, possibly decades, before India has the right number at the right places. To what extent do you think medtech, which is increasingly machines are becoming smarter with AI, data, better analytics, to what extent do you think machines can plug in the productivity gap that the industry is going to need over the next 5 to 10 years?
It's a very important question. When you look at today surgeries happening in hospitals, a lot of the surgeries have become robotic. Lot of you see a lot of AI being used today in healthcare. So, and there's a lot of data being generated. So, and that gives information to a healthcare practitioner that what exactly he needs to do. The decision-making process becomes very, very quick and is very informed. Today, when you look at AI being used for, reading your MRI reports, CT scans or X-rays, so that has helped to generate those data and compile that data much faster. Today, what drugs are being given to patients if the data is compiled for cancer patients, let's say, and I know in US one company is collecting that information. Now doctor just goes to that AI platform, puts that information about the patient, and immediately he could get information about the drugs being used for similar treatments rather than doing a hit and trial method. So these kind of information would help us. I think data collection, I think digital health, we already have a national digital health policy. And I think this has to be implemented in toto. It's not that it stays on paper. So that is what I think personally. And a lot of information is out there. Only thing is we have to collect. If we have a national registry of information, like the way ICMR is collecting data. Now, can this data be shared with private companies, which can help to let's say predict disease patterns, to understand that what went wrong for which each patient. Today we know that following COVID patients got impacted, they had clots, they had low platelet counts. Now if we can mine that data, understand what drugs were given, so at least you're prepared for the next wave. You're prepared for because you have the information to back you up, which is not there today, in the system. It's all hidden trial today. If you don't, we already had a ready prescription for all COVID patients on WhatsApp. That's the most dangerous thing we had during this COVID crisis. Everybody knew what drug to take, what vitamins to take, what tests to get done, and when to get done. Nobody was consulting a doctor. So, and this was without any data, without any information. So we need a very reliable national database for information gathering. And that should be shared with select private companies, even pharma companies today, to understand the disease burden and design or develop products, even medtech companies, because medical technology will be a very important role going forward. Whether it's an AI, whether it is robotics, whether it is, remote consulting, a lot of things will be very, even today, when we look at, ultrasound, today, a lot of ultrasound techniques or remote wireless techniques are being used to do guided, guided catheter, let's say guidance, catheter guidance, or even for placing certain devices in patient's body. These are all wireless. These are all, real-time data, which are even a doctor can see from a distance. So all these important things have to happen in next few years to really augment, our capability from the same people. I know what you said. We don't have enough doctors, enough nurses, but can we really train them better on newer technologies so that we can, treat people more efficiently and much faster?
Very, very important point you are making in terms of using data not for compliances alone, but really using it for insights and information and knowledge, and then feed that knowledge back through a framework, whether it is digital health framework, the NDHM framework, so that the right, the roles and responsibilities, the accountability is there, but the right people with gets the right information. Very important point, Himanshu. I'm just picking up some questions that are coming in on the chat box, and I'm trying to club some questions into common themes. One of the important priorities, it seems almost commonsensical, that India requires surge capacity, right? You have a certain amount of capacity which is there during a pandemic, and because of the backlog ahead, you need to generate maybe twice X, maybe a certain additional amount of capacity on top, and very quickly. What do you think the need of the medtech is right now for us to be able to go and strengthen the infrastructure? Obviously, medtech alone cannot do it. It has to be seen through the lens of the providers, the policymakers, the end people. But in your opinion, Himanshu, in the next couple of years, where there's a real augmentation, buildup of infrastructure required, how can medtech play a solution role there?
So, see, first of all, the issue is of demand. Because, when we talk about healthcare, the first thing we push it to states. That is a state subject. No, it's not a state subject. I think it's a national subject. Because today, let's say even in vaccination programs, you're left with the states to do the vaccination program. I think should be more centrally, should have managed more centrally. Whether it's procurement, whether it's dissipation of vaccinations, or even the medical equipment for that matter. So in my view, first of all, can we have a consolidated national demand? Every state does its own tender. India has 700 autonomous hospitals. I'm not talking about government bodies. Coal India has their own hospital. BHL has their own hospital. Everybody aims have their own demand. All central government hospitals have their own demand. Private sector has their own demand. So there is no consolidated demand. So and today our sector is not today governed or regulated. So nobody knows how many manufacturers are there. Nobody knows how many importers are there. What is the real demand? It is all made by short-term arrangements. So to really understand, so we should make a list of critical devices. And I think we are doing through a task force. I was just in this meeting an hour ago. So if we have a critical list of medical equipments, a national demand for that, okay, I would need, let's say 50,000 ventilators every year. Then it's very easy for the industry to understand the demand and augment their manufacturing capacity as per the national need. Now today, Karnataka may buy 20,000 ventilators, but Rajasthan buys only 2,000 ventilators. So nobody knows what Maharashtra is going to buy. So we need to bring it at a national level, demand of critical medical equipment. Then we have seen already that there is a capability. Whether it was ventilators or even oxygen concentrates, I read in the newspaper ad that Microtech is going to make 300,000 concentrators a month. They have a capacity of 3 million now, which is, I think, good enough to export and even to meet countries' local demand, because at peak we were importing 300,000 concentrators a month. So there is a capability, but I think we need to collate the data and throw it out to the manufacturers, to companies which are in this business, whether it is importers, manufacturers, doesn't matter. But the data has to be there to have that information. So can you remind me of the second question, Siddharth? Siddharth, you're on mute. Yeah.
My apologies. You have touched upon many points there. You've talked about fragmentation, which is not only there from a demand and from a governance perspective. Financing is fragmented, delivery of services is fragmented.
Yeah.
But I think you made a very important point about forecasting the demand and probably having a stable framework that allows people to plan to fulfill that demand and bring in the necessary capital. And be able to understand the risks in order to be able to do that. Those are extremely important points.
I'll just pick up one small point here, Siddharth. When we talked of vaccination program, now we are saying in August we will vaccinate 1 crore people per day. That means a requirement of 10 million syringes a day, which is 300 million a month. Now, do we have enough capacity to make those syringes in the country? I don't think we have. Otherwise, there will be a shortage of syringes in the curative market.
Correct.
So if you are going to use those same syringes for vaccination, then there will be shortage for curative. Do we have enough vial making capacity? The vials which are needed for vaccines, or the stoppers which are needed. So that's the question we need to answer. Now we may make plans that I'm going to do this, but do we have backup data information to execute that plan? I think that's the critical area we lack in the country, and that's where we need to strengthen.
Great. Himanshu, I'm just going to come to the last question. We have another 5 minutes or so, but one of the things you touched upon in your introduction was, you have about 50 R&D engineers within PolyMedicure. So it's very clear that R&D and innovation is the oxygen as far as the medtech industry is concerned. It's one of the very important attributes. What is your view on the contribution of the medtech startups or the medtech innovation that you have seen in the COVID management? And what role can it further play in helping us build a better health system that is going to come in a post-COVID era?
I think that's a very, very important question, Siddharth. I think the biggest challenge today is, I think in India, there could be around 200 to 300 medtech startups today working in tandem. But the biggest challenge for them is the market for their products. Today, our procurement system, whether it's a government procurement system or whether it's a private, healthcare system which procures medical equipments or devices, they don't buy these equipments. They don't, let's say, uh, I would say, patronize these companies. And why? First of all, when a startup goes to a hospital, I have got this device. Where is your test data? How many hospitals you have sold this product to? And they can't predict the demand for these kind of products, so they don't know when to scale up manufacturing. They don't know where to test the product. When they go to government, there's no mechanism in the government. Now today everything you have to register at GEM for government to buy the products. Now GEM doesn't register products which are not even validated, not even tested. So there is no mechanism in the country to let's say buy products at the government level or at a private sector level from startup companies, and they keep on struggling in the same cycle. They develop products, and plus there is no industry startup partnership today. Of course, GE does a lot of work, a lot of other big companies do a lot of work. They have incubators, they patronize startups, but at the end of the day, I think only 1 out of 100 survives. And I think that is the biggest dilemma we have in our country, that if we have a platform where startups, industry, and academia all come together, and the platform is where the startups can pitch for the technology, the industry can help them to accelerate, like what Maruti did with AFGA or Scanray, was held by BEL. If we have those kind of platforms where industry can come and help the startups, I think today I don't know how many startups are operating in medtech space in India. And even I have, let's say, capital, even I have the time to help them, but I really don't know how to approach them. And they don't know how to approach us. So how can we bring this platform at one level? Can we have kind of a national registry of startups and industry where they can do matchmaking? Can we bring in academia? Can we bring in hospitals? Can we bring in government on that platform? So we need to have a single platform where we bring everybody together. I think that would be a great starting point where we can incubate these startups and help them grow very, very quickly, to the next level. And otherwise, see, there's no dearth of capital, Siddharth, honestly. Today, there are people to back good startups. We have seen 20 unicorns in the last 4 months in India. So there is enough money available in the ecosystem to back those startups. But the only point is, how do we, take them to the next level and they don't die in the valley of death?
Correct.
So that is my limited point here. But I think we need to bring that, platform. Can we create that kind of platform today? That's the point.
Correct. So Himanshu, you have touched upon the need for the ecosystem to be more integrated. Someone said once upon a time that the most interesting problems are always in the intersection of major disciplines, right? And healthcare is probably one of the most important and the interesting problem. As a nation, we have to tackle it. We are very thankful that we have your leadership in Nat Health, and many of these problems are areas where a lot of the leaders in Nat Health are thinking deeply about. And we hope to find common solutions with the ecosystem thinking through how best it can be addressed. We are at the end of our time today, allotted time, but I would like to first of all thank all the frontline workers and those who have taken the time and send their questions either in advance or during this session. This entire the conversation today would be put up live on the social media channels. Also, they will be transcribed as blogs and be distributed widely. So for those who have not been able to see it today, they will have an opportunity to go through it and play it back again. I certainly would like to thank Himanshu for taking the time from his busy schedule. He's extremely busy with so many things going on and preparing for the next wave of the pandemic. And also this particular wave is not over yet as we speak. Would like to thank everyone who put this webinar together, the organizers. Again, on Saturday, we have another session coming up, and we have Mr. Ram Gopal Walad from Azim Premji Foundation who will be coming and speaking. And we'll have a different point of view, I'm sure, from outside industry. So for those questions we couldn't take up today, we'll certainly take them up in the next session. So those words, I would like to thank everyone. Thank you, Himanshu, again. And
Thank you, Siddharth. Thank you, Anvesha.
Thank you. Bye-bye.